iron status, the alcohol user usually normally they have increased iron stores, or due to increased iron from intake from absorption from intestine, due to from food or from the drinking of alcohol, iron contained beverages, or they can have iron deficiency status also due to hemorrhage. Then alcohol induced bone marrow damage that mainly resulted in ineffective erythropoiesis, that also contribute to increased iron store. So there are several mechanisms of this increased iron store or iron deficiency. So one of the paper published in 2001 is bone marrow failure and hematological abnormalities in alcoholic liver cirrhosis. So they have evaluated the bone marrow and peripheral blood pictures changes in alcoholic cirrhosis patient, and they have showed that 91% patients they had leukopenia, thrombocytopenia and anemia. However, the bone marrow was there was mild alteration in the bone marrow. There was a high cellularity with features of activation, that is atrial hyperplasia and moderate megaloblastosis, and mild myelofibrosis also. So if we analyze our data, that is well collaborated with their data also, particularly in bicytopenia cases and anemia patient, that is responsible for 50% of the study group. Then the rest of the 50% cases, that is pancytopenia group, so there are variable findings like iron deficiency, megaloblastic anemia, dual deficiency and hypocellular bone marrow. Another important findings that is usually noted in alcoholic liver disease patients, that is presence of large vacuoles, that is resulted from the damage of the cells in early stages like proectoblast, and granulocytic series also can show this presence of this large vacuole by ethanol, that is absent in these cases. All the cases we have not noticed, but it has been said this presence of these vacuoles, they usually appear after 7 days of starting the intake of alcohol, and if we stop, then within 14 days they disappear. So maybe the hospital, all these patients are admitted in the hospital that they are not under influence of alcohol. That's why maybe we are not getting this common finding. So the bone marrow findings remain unchanged. What we have noticed in one patient, that was bone marrow was repeated after 3 years, with similar peripheral findings of bicytopenia, had similar bone marrow findings. So if there is no stoppage of alcohol, so usually there is no change in bone marrow. So conclude, the pyocytopenia may be an indication of bone marrow regeneration provided the patient has stopped alcohol for at least 2 to 4 weeks. So this is I observed from my small study.